medications that you will see within the neurological system. So our first type of medications are anti-myasthenic or anticholinesterase medications. So these are used to relieve muscle weakness associated with myasthenia gravis by blocking the acetylcholine breakdown at the neuromuscular junction. So you can see your example medications there. Again, these are used to treat or diagnose myasthenia gravis, and they're used to determine if a crisis is present. So your neostigmine and your pyridostigmine, they're used for myasthenic symptoms, whereas your edophonium is used to diagnose myasthenia gravis or to determine if a crisis is present. All right, so the use of these may lead to a cholinergic crisis. So overdose of anti-myasthenic medications would lead to a cholinergic crisis, and then an underdose of anti-myasthenic medications would lead to a myasthenic crisis. So signs of a cholinergic crisis, they're going to be abdominal cramps, nausea, vomiting, diarrhea, increased tearing, salivation, secretions, perspiration, hypotension, bradycardia, and then bronchospasm and wheezing. So patient education in regards to this drug class, you want to educate the patient to take the medication with a small amount of food to decrease any GI upset. And then you want to wait 45 to 60 minutes after taking the medication to eat in order to prevent the possibility of aspiration. So medications for the treatment of multiple sclerosis. So there are immunomodulators and immunosuppressants. So your immunomodulators examples are interferons. Side effects include flu-like reactions, hepatotoxicity, and depression. And then your immunosuppressants, your example is mitoxantrone. Side effects include cardiotoxicity, reversible hair loss, and injury to the GI mucosa. So treatment of acute episodes of multiple sclerosis usually involve giving large doses of IV steroids to help to suppress inflammation. Also, other types of medications will be used to treat different symptoms, such as Zoloft or Prozac is often used to treat the associated symptom of depression. All right, anti-Parkinsonian medications. So these, they restore the balance of neurotransmitters, acetylcholine and dopamine in the CNS. So treatment helps to decrease the symptoms of Parkinson's to maximize the patient's functional abilities. So you have dopaminergic medications like carbidopa, levodopa, and then you have anticholinergic medications like benztropine. Now, your dopaminergic medications, like an example, carbidopa, levodopa, they are contraindicated in patients with cardiac, renal, or psych disorders. Side effects include dyskinesia, urinary retention, dry mouth, sleep disturbances. You do not want to discontinue the medication abruptly. It is also important to educate the patient that their urine or sweat may be discolored. This discoloration is harmless, but it may stain the clothing. And then in patients with diabetes taking dopaminergic medications, they should avoid glucose testing via the urine because the results will not be reliable. So a few things to know about carbidopa, levodopa. So carbidopa, levodopa taken with an MAOI antidepressant such as isocarboxacid can cause a hypertensive crisis. So you do not want to take carbidopa, levodopa, and isocarboxacid or any MAOI together. Also, patients taking carbidopa, levodopa should equally divide their daily protein between all meals. So a high protein diet will interfere with the medication's availability in the CNS. So you want to evenly divide that protein throughout the day. Also, you want to educate the patient on the importance of avoiding excessive amounts of vitamin B6, which is found in like meat, cheeses, liver, to prevent any medication interactions as well. Now, your anticholinergic medications, you will see this repeated over and over again, but it's very important that you know. Your anticholinergic medications are contraindicated in patients with glaucoma. So they block the cholinergic receptors in the CNS, thereby suppressing acetylcholine activity. So they reduce tremors and drooling, but they have a minimal effect on bradykinesia, rigidity, and balance abnormalities. Side effects of anticholinergics are going to include constipation, urinary retention, blurred vision, dryness of the oral cavity, and confusion. So again, it's contraindicated in patients with glaucoma. Using caution in patients with COPD, because those patients with COPD may develop very thick, dry mucus secretions. And then if a patient does stop an anticholinergic suddenly, the signs of Parkinson's, like rigidity, tremors, that shuffling gait, it may all be intensified if they discontinue the medication abruptly. All right, anti-seizure medications. So they're used to depress abnormal neuronal discharges and prevent the spread of seizures to adjacent neurons. So you can see the different types of drug classes there, and we'll get into a few of them. Know that anti-seizure medications have a lot of drug-to-drug interactions, so you have to be very careful in the medications that you give them with. So for example, they should be used in caution with the use of anticoagulants, aspirin, sulfa drugs, and then antipsychotic medications. Also, the absorption of anti-seizure medications is decreased with the use of antacids, calcium preparations, and anti-neoplastic medication. So just a lot of drug-drug interactions with them. All right, so Heiden's-Hohen. So your most common example of this that you're going to see is phenytoin. So phenytoin is used to treat partial and generalized tonic-clonic seizures. It can also be used to treat cardiac dysrhythmias. Side effects are going to include gingival hyperplasia, sedation, nausea, vomiting, and blood dyscrasias. Know that your normal phenytoin level is 10 to 20. When giving in the hospital or giving in addition to tube feeds, so tube feeds can often interfere with the absorption of phenytoin. So you want to schedule both as far apart as possible. And then whenever you're giving phenytoin via IV, you need to only dilute it in normal saline. You're not going to dilute it in dextrose. And the medication must be given slowly to prevent any hypotension and cardiac dysrhythmias. Also, it's important to know that phenytoin may decrease the effectiveness of some birth control medications, and it also has teratogenic effects if it's taken during pregnancy. All right, so your barbiturates. The most common is the phenobarbital. It's used for the treatment of tonic-clonic seizures and then for acute episodes of seizures caused by status epilepticus. Side effects include sedation, dizziness, low blood pressure, and respiratory depression. Your benzodiazepines, these are a lot more common. These end in PAM, clonazepam, lorazepam, diazepam. They're used to treat absent seizures. Side effects are going to be drowsiness, dizziness, blurred vision. And then when given IV, you want to be sure to give it slowly to prevent bradycardia. So it is important to know that a medication called flumazenil, so Flumazenil, flumazenil, it reverses the effects of benzodiazepines. So it's the antidote for a benzodiazepine overdose. However, it's important to know you do not want to give it in patients with increased intracranial pressure or status epilepticus who are treated with benzos, because additional problems may occur with reversal. However, if it's a patient without status epilepticus or with a normal ICP, you're going to want to give the flumazenil for a benzo overdose. All right, so aminostilbenes, this is also used to treat seizure disorders that have not responded to other anticonvulsants. They can also be used to treat trigeminal neuralgia. So your most common example is carbamazepine or Tegretol. All right, your CNS stimulants. So these are going to be your amphetamines such as Adderall, Ritalin, your caffeine. There's a high potential for abuse with your CNS stimulants. Your side effects are going to include irritability, restlessness, tremors, insomnia. heart palpitations, anorexia, weight loss. Just think about what caffeine does to the body and kind of explode that a little bit. So with your CNS stimulants, you're never going to want to discontinue the medication abruptly. You're going obviously to want to avoid caffeine while taking the medication, and you're going to want to monitor for withdrawal symptoms. So this includes nausea, vomiting, weakness, headache. And then if it's a school-age child taking Adderall or Ritalin for the treatment of ADHD, you're always going to want to notify the school nurse, and then monitor the child's growth as they're taking the medication. So non-opioid analgesics, you have NSAIDs like ibuprofen and naproxen, and then acetaminophen or Tylenol. Your NSAIDs, so non-steroidal anti-inflammatory drugs, they inhibit the synthesis of prostaglandins. They're used to treat pain and relieve inflammation. They are contraindicated in a patient with renal or liver disease. You do not want to take them in combination with anticoagulants. And know that some side effects include sodium and water retention, decreased renal function, and gastric irritation. So NSAIDs are often used for the treatment of arthritis, tendinitis, acute gout, anything that causes acute pain. Know that aspirin and an NSAID should not be taken together because aspirin can decrease the effectiveness of the NSAID and it can increase the risk for bleeding. Also, hypoglycemia may result if ibuprofen is taken with insulin or other hypoglycemic medications. And then there's a high risk for NSAID toxicity if it's taken concurrently with a calcium channel blocker, such as amlodipine. And then, as always, you want to avoid the use of aspirin in adolescents and children due to the increased risk for Reye syndrome. All right, so acetaminophen. So Tylenol is used to decrease pain and fever. It is contraindicated in liver dysfunction, those with alcoholism and renal disease. Side effects include hepatotoxicity, anorexia, nausea, vomiting, and hypoglycemia. Always know your antidotes. So the antidote for Tylenol overdose is acetylcysteine. All right, so your opioid analgesics, these suppress pain impulses. Of course, there is a very large concern for dependence and respiratory depression with these medications. So this is your codeine, your hydromorphone, morphine, methadone, and meperidine. So your codeine, it's an effective cough suppressant at a low dose. It can cause constipation. Hydromorphone can decrease respirations, can also cause constipation. With morphine, the primary concern is going to be respiratory depression. It can also cause hypotension and constipation. It's usually used for treat pain, acute pain or respiratory distress, especially if a patient is in palliative or hospice care at the end of life. And you always want to have Narcan available in the case of an overdose. It is very important that if a patient is on morphine, not for the purpose of comfort and quality of life, but on morphine for pain, you want to hold the medication if the respiration rate is less than 12. Methadone, it's used as a replacement medication for opiate dependence, and it's used to facilitate withdrawal from opioids. And then the meperidine, it's not commonly prescribed. It may lead to increased intracranial pressure, and then side effects include respiratory depression as well. So your opioid antagonist, this is going to be your Narcan. So it's used to treat respiratory depression from an opioid overdose. Whenever you go to give a patient Narcan, it's important to place that patient on a cardiac monitor, get very frequent vital signs, and then of course have resuscitation equipment available.